The cholinergic receptors can be just really confusing. Okay, you have two types. You have nicotinic cholinergic receptors and muscarinic. Okay, they both respond to the neurotransmitter acetylcholine, very big in parasympathetics. So remember what acetylcholine does. So for the nicotinic receptors, they're located heavily in the neuromuscular junction. So naturally, when acetylcholine binds to the acetylcholine receptors in your neuromuscular junction to these nicotinic receptors, it causes your muscles to contract. Okay, so any drug that's an agonist to these receptors essentially just causes your muscles to contract more. So that's like nicotine, acetylcholine are your nicotinic agonists. Okay, more importantly is your nicotinic antagonist. Okay, so what will block that? What will block muscle contraction? These are usually the paralytics that we use in surgery. Okay, so you have non-depolarizing agents and then you have depolarizing agents. So a non-depolarizing antagonist for nicotinic receptors is going to be like drugs like vecuronium and rocuronium, which essentially competitively bind to those acetylcholine receptors. So acetylcholine cannot bind, you don't get muscle contraction, and the patient's paralyzed in surgery. The depolarizing agents like succinylcholine will actually overexcite the neurons and then ultimately lead to paralysis. So both have the same effect, but there's a different use of each of those drugs. So those are your nicotinic antagonists. The muscarinic side, okay, these receptors very big in your heart. They have this negative chronotropic and negative inotropic effect on your heart, so making it beat a little bit less hard and less often. They go to your smooth muscles, causing them to contract, so we have some constriction there, and then a lot of glandular activity, okay, a lot of secretions. So your muscarinic agonists are basically going to ultimately increase acetylcholine and its effects on the body, okay? So some of those drugs like carbachol and pilocarpine will be used for like glaucoma. It essentially allows the ciliary bodies of the eyes to squeeze so hard that we induce fluid, that aqueous humor, to move out of that canal sclem to decrease intraocular pressure to treat glaucoma. You have acetylcholine esterase inhibitors that fall under this agonist category. This is drugs like neostigmine. So acetylcholine esterase, if you remember, is an enzyme that degrades acetylcholine in the neuromuscular junction. So if you degrade the enzyme, or if you get rid of the enzyme, you'll have increased acetylcholine in that junction and your muscles can fire. So neostigmine, the drug, will actually basically prevent acetylcholine esterase from working, and you'll increase your acetylcholine, causing more muscle contraction. So it's used for autoimmune disease called myasthenia gravis. It is also used to reverse non-depolarizing anesthetics that we just talked about. So like vecuronium and rocuronium, they will use neostigmine after surgery to basically get that person not to be paralyzed anymore, okay? Physostigmine is another drug in this category, but it does cross the blood-brain barrier as opposed to neostigmine, so it has different effects. The antagonists in this category, they're used a lot just to control secretions. So for example, my wife, when they're in surgery, they will use Robenal, which is called glycopyrrolate. It's a muscarinic antagonist that basically decreases secretions all in the airways, so they don't just have it kind of dries them out so they don't have so many issues during surgery. Atropine is another muscarinic antagonist. They're going to use that sometimes in an eye drop to help dilate the pupil, causes that pupillary reaction where we can dilate the eyes. Atropine is also used in organophosphate poisoning, so it is an antagonist in this regard. Scopolamine is another muscarinic antagonist. Scopolamine will act as a kind of a transdermal patch, and they use that for nausea and vomiting. And there's another cool muscarinic antagonist called ipratropium or ipratropium bromide that will basically do, since it's an antagonist, it will decrease the secretions and it will actually decrease bronchoconstriction, leading to bronchodilation, so they can use it to treat things like asthma and certain aspects of COPD. So hopefully that helps you understand the difference between the nicotinic and muscarinic cholinergic receptors.